Here's a development that could fundamentally reshape how American children receive their vaccines, and it's happening while most parents aren't even paying attention. While media attention focused intensely on the ongoing chaos and restructuring at the Centers for Disease Control and Prevention, a far more significant policy shift was quietly taking shape at the Food and Drug Administration during the final days of August. The agency appears to be strategically positioning itself as the primary enforcement mechanism for the Trump administration's broader campaign to substantially reduce childhood vaccination practices across the United States. But here's where it gets controversial, and this is the part most healthcare professionals are deeply concerned about. The FDA, spearheaded by Center for Biologics Evaluation and Research Director Prasad, has begun challenging a fundamental principle of pediatric immunization that has been safely practiced for decades: the simultaneous administration of multiple vaccines during single medical visits, without presenting any supporting scientific data or peer-reviewed research. The agency now claims that giving children vaccines targeting different diseases during the same appointment might somehow diminish the effectiveness of those immunizations. This seemingly technical medical position carries enormous implications that extend far beyond simple scheduling preferences. The stance directly aligns with and potentially validates long-held objectives of anti-vaccination advocacy groups, who have spent years pushing for exactly this type of disruption to established immunization protocols. And this is the part most people miss. The real-world consequences could be devastating for public health. If the FDA succeeds in implementing this approach, it would likely force the separation of well-tested combination vaccines that currently protect children against multiple diseases with a single injection. Instead of receiving comprehensive protection efficiently, children would need to endure numerous separate appointments, each requiring additional time off school for parents, extra medical visits, increased costs, and multiple painful injections spread across extended time frames. The practical burden of this fragmented approach could create exactly what public health experts fear most: a dramatic decline in overall vaccination coverage rates throughout American communities. When vaccination becomes more complicated, time-consuming, and expensive for families, fewer children ultimately receive complete protection against preventable diseases. What makes this development particularly striking is the timing and method. Rather than engaging in transparent public health discussions or presenting evidence-based research to support such a significant policy shift, these changes appear to be advancing through administrative channels while public attention remains focused elsewhere. So here's the question that every parent and healthcare provider should be asking. Is this really about improving vaccine effectiveness? Or is it actually a calculated strategy to make childhood vaccination so inconvenient that fewer families will follow through with complete immunization schedules? And if combination vaccines have been safely protecting millions of children for generations, why suddenly challenge their concurrent use without providing any scientific justification? What do you think about this approach to childhood vaccination policy? Should parents have to navigate multiple separate appointments for vaccines that have been safely combined for years? Or does this seem like an unnecessary barrier to protecting children's health? Share your thoughts. This debate affects every family in America.